Emergency electrical power policy purpose to establish clear guidelines for determining the allocation of emergency electrical power to essential and non-essential devices and equipment in the event of a power outage. Scope: this policy applies to all areas of the hospital that require emergency power backup. Definitions: emergency electrical power, or EEP, is electricity generated from an alternate source during a utility power outage to power essential equipment and devices. Essential device or equipment: any device or equipment that is critical for maintaining patient health and safety, or for ensuring the proper functioning of the hospital. Non-essential device or equipment: any device or equipment that is not critical for patient health and safety, or for the proper functioning of the hospital. Policy 1. Allocation of emergency electrical power. EEP shall be allocated to essential devices and equipment only. Non-essential devices and equipment shall not be connected to EEP. 2. Essential devices or equipment. The following devices or equipment are considered essential and shall be connected to EEP. Firstly, life support equipment, for example, ventilators, defibrillators, monitors. Secondly, emergency lighting. Thirdly, fire alarm systems. Fourthly, security systems. Fifthly, evacuation systems. Sixthly, medical equipment required for critical patient care. Seventhly, any other equipment or device deemed essential for patient health and safety or the proper functioning of the hospital. 3. Non-essential devices or equipment. The following devices or equipment are considered non-essential and shall not be connected to EEP. Firstly, appliances, for example, coffee makers, microwaves, refrigerators. Secondly, entertainment devices, for example, televisions, stereos. Thirdly, office equipment, for example, computers, printers. Fourthly, non-essential lighting. Fifthly, any other device or equipment not critical for patient health and safety or the proper functioning of the hospital. 4. Exceptions. Exceptions to the policy may be made in emergency situations where the immediate use of a non-essential device is critical for patient care. The decision to grant an exception shall be made by the department director or on-call administrator in consultation with the electrical engineering department. 5. Compliance and enforcement. Compliance with this policy is mandatory. Any unauthorized use of EEP shall be promptly investigated and disciplinary action may be taken. The electrical engineering department shall be responsible for enforcing this policy. 6. Periodic review. This policy shall be reviewed and updated as needed to ensure compliance with applicable codes and regulations and to meet the changing needs of the hospital. It's crucial to understand the specific requirements outlined in National Electrical Code, NEC, Section 517.33 regarding the critical branch within healthcare facilities. This section provides detailed guidelines on which systems and equipment must be connected to the emergency power supply to ensure continuity of care during power outages. Firstly, NEC 517.33 mandates that the critical branch must power essential systems for patient care and safety. This includes lighting and receptacles in critical care areas such as intensive care units, operating rooms, and emergency departments. The purpose is to maintain a safe and functional environment for patients requiring immediate medical attention. Secondly, life safety systems such as fire alarms, smoke detectors, and communication systems are required to be connected to the critical branch. These systems are vital for alerting staff and patients to potential hazards and facilitating a safe evacuation if necessary. Thirdly, certain medical equipment necessary for patient monitoring and treatment must be powered by the critical branch. This includes ventilators, cardiac monitors, and infusion pumps. Ensuring these devices remain operational is crucial for maintaining patient stability during a power outage. Fourthly, NEC 517.33 also addresses the need for critical branch power in areas where medications and medical supplies are stored. Refrigeration units and other temperature-sensitive equipment must be connected to the emergency power supply to prevent spoilage and maintain the integrity of these essential items. To further clarify, let's delve into how these requirements translate into practical applications within a hospital setting. In operating rooms, for example, the critical branch must supply power to surgical lighting, anesthesia equipment, and patient monitoring devices. Any interruption in power to these systems could jeopardize patient safety and the success of surgical procedures. Similarly, in intensive care units, ventilators, cardiac monitors, and other life support equipment must remain operational at all times. The critical branch ensures that these devices continue to function, providing uninterrupted care to critically ill patients. Emergency departments rely heavily on the critical branch to power essential equipment such as defibrillators, diagnostic imaging devices, and emergency lighting. These systems are vital for assessing and treating patients in critical condition, and any disruption in power could have severe consequences. Moreover, the critical branch supports communication systems throughout the hospital, enabling staff to coordinate emergency responses and maintain contact with external resources. This is particularly important during mass casualty events or other emergencies that require a coordinated response. Beyond these specific areas, NEC 517.33 also addresses the need for critical branch power in other essential locations such as pharmacies, laboratories, and central sterile supply departments. These areas play a critical role in patient care, and any disruption in their operations could impact the hospital's ability to provide timely and effective treatment. To ensure compliance with NEC 517.33, hospitals must conduct regular inspections and maintenance of their emergency power systems. This includes testing generators, transfer switches, and other components to verify their proper operation. Additionally, hospitals should develop and implement comprehensive emergency power management plans that outline procedures for responding to power outages and prioritizing the use of emergency power resources. In summary, NEC 517.33 provides a framework for ensuring the reliability of emergency power systems in healthcare facilities. By adhering to these guidelines, hospitals can minimize the impact of power outages on patient care and maintain a safe and functional environment for staff and patients. Understanding the distinction between essential and non-essential equipment is paramount in developing an effective emergency electrical power policy. Essential equipment directly contributes to patient care, safety, and the overall functioning of the hospital. Non-essential equipment, while potentially convenient or useful, does not have a direct impact on these critical functions. When allocating emergency power, priority must always be given to essential equipment to ensure that the most vital services remain operational during a power outage. To further illustrate this distinction, consider the following examples. Ventilators, which provide mechanical respiratory support to patients who are unable to breathe on their own, are unequivocally essential. These devices are life-saving for patients with severe respiratory illnesses or injuries, and any interruption in their operation could have fatal consequences. Similarly, cardiac monitors, which continuously track a patient's heart rate, rhythm, and other vital signs, are essential for detecting and responding to cardiac events such as arrhythmias or heart attacks. Defibrillators, which deliver an electrical shock to restore normal heart rhythm, are also essential for treating life-threatening cardiac emergencies. Emergency lighting is another critical component of the essential equipment category. During a power outage, emergency lights provide illumination to allow staff to safely navigate the hospital and continue providing patient care. Fire alarm systems are essential for detecting fires and alerting staff and patients to evacuate the building. These systems are vital for protecting lives and property in the event of a fire. In contrast, coffee makers, microwaves, and refrigerators are generally considered non-essential equipment. While these appliances may provide convenience for staff and visitors, they do not directly contribute to patient care or safety. Entertainment devices such as televisions and stereos are also classified as non-essential. These devices may provide entertainment or distraction, but they are not necessary for maintaining patient health or the proper functioning of the hospital. Office equipment such as computers and printers may be necessary for administrative tasks, but they are not considered essential for patient care during a power outage. Therefore, these devices should not be connected to emergency power unless absolutely necessary. It is important to note that the classification of equipment as essential or non-essential may vary depending on the specific circumstances of the hospital. For example, a refrigerator used to store medications or vaccines may be considered essential, while a refrigerator used to store staff lunches would be considered non-essential. In some cases, equipment that is normally considered non-essential may become essential during a particular emergency. For example, a portable air conditioner may be necessary to maintain a safe temperature in a patient care area if the building's central air conditioning system fails. In these situations, the department director or on-call administrator should consult with the electrical engineering department to determine whether an exception to a policy is warranted. To ensure that the emergency electrical power policy is effectively implemented, it is important to communicate the policy clearly to all staff members. This can be accomplished through training sessions, written materials, and regular reminders. Staff members should be aware of the types of equipment that are considered essential and non-essential, and they should understand the procedures for requesting an exception to the policy. The electrical engineering department should be responsible for enforcing the policy and investigating any unauthorized use of emergency power. Disciplinary action may be taken against staff members who violate the policy. The emergency electrical power policy should be reviewed and updated periodically to ensure that it remains relevant and effective. The review process should involve input from various stakeholders, including medical staff, nursing staff, administrative staff, and the electrical engineering department. The policy should be updated to reflect changes in technology, regulations, and the needs of the hospital. By following these guidelines, hospitals can develop and implement an effective emergency electrical power policy that ensures the safety of patients and staff during a power outage. Let's clarify some vital points regarding the implementation and maintenance of an emergency electrical power, or EEP, policy within a hospital setting. Firstly, it is essential to establish a clear chain of command for decision-making during power outages. This includes identifying individuals who have the authority to grant exceptions to the policy and prioritize the allocation of emergency power resources. Secondly, regular training programs should be conducted to educate staff members on the EEP policy and their roles and responsibilities during power outages. These programs should cover topics such as the location of emergency power outlets, the types of equipment that are considered essential and non-essential, and the procedures for reporting power outages. Thirdly, hospitals should develop and maintain detailed documentation of their EEP system, including schematics, equipment specifications, and maintenance records. This documentation should be readily accessible to staff members and emergency responders. Fourthly, regular inspections and testing of the EEP system should be conducted to ensure that it is functioning properly. This includes testing generators, transfer switches, and other components to verify their performance under load. Fifthly, hospitals should establish procedures for managing fuel supplies for emergency generators. This includes monitoring fuel levels, arranging for fuel deliveries, and ensuring that fuel is properly stored and maintained. Sixthly, hospitals should develop contingency plans for prolonged power outages. These plans should address issues such as patient relocation, staffing shortages, and communication with external agencies. Seventhly, hospitals should establish a system for tracking and reporting power outages. This information can be used to identify trends, evaluate the effectiveness of the EEP policy, and improve emergency preparedness efforts. Eighthly, hospitals should participate in regular drills and exercises to test their EEP system and emergency response procedures. These drills should involve staff members from various departments and should simulate real-world scenarios. Ninthly, hospitals should collaborate with local utilities and emergency management agencies to coordinate emergency response efforts. This includes sharing information, participating in joint planning activities, and coordinating resource allocation. Tenthly, hospitals should continuously monitor and evaluate their EEP policy and emergency preparedness efforts. This includes soliciting feedback from staff members, analyzing data on power outages, and reviewing relevant regulations and guidelines. It's important to remember that the emergency electrical power policy is not a static document. It should be updated regularly to reflect changes in technology, regulations, and the needs of the hospital. By following these guidelines, hospitals can ensure that their EEP system is reliable, effective, and capable of protecting patients and staff during a power outage. Remember that ongoing training and education are vital components of an effective EEP policy. All staff members should receive regular training on the policy, their roles and responsibilities during power outages, and the proper use of emergency equipment. Training should be tailored to the specific needs of different departments and job roles. In addition to formal training programs, hospitals should also provide ongoing education and awareness activities to reinforce the principles of the EEP policy. This can include posting informational materials, conducting regular briefings, and incorporating EEP-related topics into staff meetings. It's also important to encourage staff members to report any concerns or suggestions regarding the EEP policy. This feedback can be valuable for identifying areas for improvement and ensuring that the policy remains relevant and effective. Another key element of an effective EEP policy is the establishment of clear communication protocols. During a power outage, it is essential to have a reliable means of communicating with staff members, patients, and external agencies. This may involve using a combination of communication methods such as telephones, radios, pagers, and email. Hospitals should also establish a designated communication center to coordinate emergency response efforts. The communication center should be staffed by trained personnel who are familiar with the EEP policy and emergency response procedures. In addition to internal communication, it is also important to establish protocols for communicating with external agencies, such as local utilities, emergency management agencies, and the media. This communication should be coordinated by designated spokespersons who are authorized to release information to the public. Furthermore, hospitals should have a plan for managing visitors during a power outage. This may involve restricting access to certain areas, providing escorts for visitors, and communicating relevant information about the situation. The safety and security of visitors should be a top priority during a power outage. The periodic review and update of the emergency electrical power policy are essential for ensuring that it remains relevant and effective. The review process should involve input from various stakeholders, including medical staff, nursing staff, administrative staff, and the electrical engineering department. The policy should be updated to reflect changes in technology, regulations, and the needs of the hospital. The review process should also include an assessment of the policy's effectiveness in addressing past power outages. This assessment should identify any areas where the policy could be improved. In addition to the formal review process, hospitals should also continuously monitor and evaluate their EEP policy. This can involve soliciting feedback from staff members, analyzing data on power outages, and reviewing relevant regulations and guidelines. The goal of continuous monitoring and evaluation is to identify potential problems and make necessary adjustments to the policy on an ongoing basis. By implementing these measures, hospitals can ensure that their emergency electrical power policy is effective in protecting patients and staff during a power outage.